Hello, the study introduced today is about comparing antibody response after the third dose of the COVID-19 vaccine in patients who received liver and kidney transplants. This study was conducted by the Department of Infectious Diseases, Liver Transplantation Team, and Kidney Transplantation Team at Asan Medical Center in Seoul. In March 2021, COVID-19 vaccines were rolled out. Compared to the general population, solid organ transplant recipients had lower protection against symptomatic COVID-19 after vaccination, as well as higher rates of breakthrough infection. This may be due to the reduced immunogenicity of the vaccine in these patients due to their weakened immune systems, which is why the CDC recommends a 3-dose vaccine as primary series in moderately immunocompromised patients. Therefore, it will be important to study the immune response to COVID-19 vaccination in these patients. The table shown on the left is a study published in JAMA in 2021, and the antibody production rate after 2 doses of COVID-19 vaccine was about 80% in liver transplant recipients and 56% in kidney. As shown in the right figure, the antibody production rate was 50% in liver transplant patients and 33% in kidney transplant patients. Also, if you look at these studies, you can see that liver transplant recipients generally show a higher antibody conversion rate than kidney transplant recipients after 2 doses of COVID-19 vaccines as shown in the table. This is data from Asan Medical Center in Seoul. In patients who underwent liver transplantation, antibody production rates were about 56% for adenoviral vector vaccine and about 77% for mRNA vaccine after 2-dose vaccine, which were similar to the data of previous studies. On the other hand, 101 solid organ transplant recipients who completed primary series vaccination with BNT162b2 3-dose showed an antibody production rate of about 68%. Specifically, when looking at participants according to the transplanted organ, antibody seropositivity was 62.3% in kidney transplant recipients as shown on the left, and 96.9% in liver transplant recipients as shown on the right. In other words, there seems to be a tendency to show a higher seroconversion rate in liver transplant recipients than in kidney transplant recipients after the 3-dose vaccination in previous studies. Therefore, the aim of this study is to compare the antibody production rate after the 3rd-dose vaccination in kidney and liver transplant recipients. In addition, we would like to find out the factors contributing to higher seropositivity in liver transplant recipients than in kidney transplant recipients. A prospective study cohort was recruited from June 2021 to February 2022 at Asan Medical Center, which performs more than 500 liver transplants and 400 kidney transplants per year. Participants with previous infection were excluded, and blood sampling was performed 3 weeks after the 3rd dose vaccination. S1 specific immunoglobulin G was measured by ELISA for the immunological evaluation. This is a schematic diagram of study participants. Antibody titers were measured in 76 liver transplant recipients and 17 kidney transplant recipients respectively. 13 of the liver transplant recipients received mRNA vaccine as the 3rd dose after the 2 doses of adenoviral vector vaccine. These are the baseline characteristics of the study participants. In kidney transplant recipients, rejection history, rituximab use within 1 year, and high-dose steroid use were higher compared with liver transplant recipients. In addition, the use of steroid and mycophenolate acid among maintenance immunosuppressants was significantly higher in kidney transplant recipients than in liver transplant recipients. Next, let's look at the antibody response. The figure on the left compares the antibody responses of healthy volunteer cohort and solid organ transplant recipients. Compared to healthy volunteers, the antibody seropositivity was significantly lower in solid organ transplant recipients, and kidney transplant recipients showed a significantly lower antibody titer than liver transplant recipients. On the other hand, as shown in the figure on the right, there was no significant difference in antibody levels between the group that received 3rd-dose mRNA vaccine after the 2-dose adenoviral vector vaccine and the group that received the 3-dose mRNA vaccine. Next, we investigated the risk factors that had a significant effect on the antibody conversion rate. In univariate analysis, duration of 3 years or more after organ transplantation. Rituximab use within 1 year, T-cell immunosuppressant use. In maintenance immunosuppressant use, especially steroids and mycophenolate acid, were significant risk factors for seronegative antibody responses. In multivariable analysis, only the use of mycophenolate acid was identified as a significant risk factor for seronegative antibody responses. Conclusion: kidney transplant recipients showed significantly lower antibody conversion rates than liver transplant recipients after the second and third dose of COVID-19 vaccine. Mycophenolic acid use was a significant risk factor for seronegative antibody responses after 3-dose vaccination. Thank you for your attention.